Here with us today, our keynote speaker is none other than Dr. Lahiru Kodithuwakku himself. He is the medical officer at the National Dengue Control Unit for the Ministry of Health. He is qualified with an MBBS plus a Master's of Science in Community Medicine, along with a program with a postgraduate diploma. Yeah, in the health sector, disaster management. As quoted by Doctor himself, there are around 100 to 400 million cases, dengue infection cases, reported every year, according to the World Health Organization. Therefore, we are truly blessed to have Dr. Lahiru here with us today to debunk any myths you may have heard and also to share with us the bitter truth about this silent killer. For those of you who joined and registered with us early, you got the chance to share with us any question in relation to dengue that you can ask doctor. So we will fulfill your request today. And for those who couldn't register early, no worries, because we have you covered as well. At the end of this webinar, we will be having a live question and answer session so that you can ask your questions as well. How amazing is that? So, Dr. Lahiru, the first question we have today, what is dengue exactly?
Yeah, Anika. First of all, thank you very much for Lyceum International for giving us the opportunity to discuss a burning issue in the country. Dengue, you can easily say that it is the most common vector-borne viral disease in the world. Vector-borne in the sense that it is transmitted through a mosquito, right? So dengue is, when you talk about the geographical distribution, as you said, dengue is mostly common in tropical countries as well as in subtropics. When it comes to our region, that is Southeast Asian region, it's a grave issue, a grave public health issue. And when it comes to Latin America, as well as some of the countries in Australia and Oceania, they report a significant number of dengue cases. So dengue is a viral disease, as same as the COVID, I think. Yeah. But there are some differences, right? We will talk about these differences.
Yeah, we have a few questions in regards to that as well.
Yeah. So when it comes to Sri Lanka, we reported our first case in early 1960s, right? And there were some sporadic outbreaks of the disease in the next decades. But since the early 90s, we are observing outbreaks of increase in magnitude, right? And the distribution pattern has also been changed a little bit, right? So this is sort of a hyperendemic disease in Sri Lanka. Hyperendemic means that this disease is constantly present in Sri Lanka in a considerable, with a considerable number of cases. So that is dengue for you. A brief introduction.
So I guess even that covers the question of how it's distributed in Sri Lanka as well, yeah? Our next question we have for you, doctor, is how is this disease exactly transmitted from human to human?
Right. So as I said, it is transmitted through a mosquito or a vector. Now we have two vectors in dengue. One is called a mosquito called Aedes aegypti, and the other one is called Egypt albopictus. We have several differences in this mosquito as well. All right. So once a human who is infected with dengue virus, once a mosquito bites a human who is infected with dengue virus, then that dengue virus will be transmitted into the mosquito, and that mosquito will carry the virus into another human. That is how it will spread. Now, in scientific terms, you have extrinsic life cycle of a mosquito and the intrinsic life cycle. So in simple language, it is mosquito to human transmission and human to mosquito transmission. So you need to have a host, that is the human. You need to have a vector, that is the mosquito, and you need to have a susceptible environment. That means an environment where the vector can breed. So all these three things combined, then you have the dengue infection.
Like mothers who are pregnant and stuff, can the baby get it if the mom has dengue?
Yes, there are literature. I mean, in the scientific literature, there are cases that have been reported that means the transmission from mother to child. But it all depends on which trimester or on which time you get the dengue disease during the pregnancy. But there are, yes, as you said, there is literature.
And doctor, what would you say are the clinical symptoms or the warning signs of dengue?
Now, before going into that, Anika, let me explain a little bit about the dengue virus as well. Right now, dengue virus, the specialty of the dengue virus is it has 4 types, similar to what you have in COVID. You know that COVID has, we say Delta, we have we have Omicron, but in dengue we have 4 subtypes. That is dengue virus type 1, dengue virus type 2, 3, and 4. The peculiarity of this virus is once you are infected with, say you are infected with dengue virus 1, type 1, then you have some immunity for that one, but no immunity for other virus types. That's the issue you have, right? So in a lifespan of a human, theoretically you can get 4 types. Dengue you can get 4 times, right? And you don't have cross immunity, as I said. And the second most important thing is if you are infected with dengue virus for the second time, the disease severity might be, I mean, more grave than the first infection. There are evidence for that. So that is the peculiarity of this virus. Now, when it comes to clinical symptoms, there are differences in clinical symptoms of children as well as in adults. But as a whole, what you say is you have a wide spectrum of clinical symptoms. Now, dengue is a wide spectrum disease. Wide spectrum means you have the mild disease as well as you have the severe forms that can uh, end up with death as well, right? So these mild forms, you have dengue fever, then you have what you call the severe form dengue hemorrhagic fever, then you have dengue shock syndrome, then you have what you call complicated dengue, and you have the death. So you can see the spectrum is wide, right? And the other important thing is you have a substantial number. Actually, this is the majority of asymptomatic cases. Now, if you take a sample from a population, 75% of this sample will be asymptomatic, while 25% will be showing symptoms, right? Out of that 25%, 80% will be showing mild symptoms, and just 20% will be showing the severe symptoms. So that is how the clinical spectrum has been distributed, right? So going on with your question, now what are the clinical features? Now in dengue fever, you have high fever of duration from 2 to 7 days, right? That can change a little bit depending on the time, right? Then you have what you call the retroorbital pain. Retroorbital pain means the pain behind the eyes. Now, if you have been infected with dengue, anyone who has been infected with dengue, they will say, like in Sinhalese, they say mage ඇස් දෙක පිටිපස්සේ රිදෙනවා. So that is unique to dengue. Then you have what you call arthralgia. That means you have severe pain in joints. Then you have myalgia, that is muscle pain, right? Then you can have bleeding. You can have reduced urine output or no urine output at all, right? So these are the basic clinical symptoms that you have, right, when you infected with dengue. But there is a separate sort of a cohort that go into warning symptoms of dengue as well. Now, what are these warning symptoms? Warning symptoms are continuous vomiting, right? If you have abdominal pain, if you have bleeding from any orifices, say it from your gums while you are brushing, or say it from your nose when you are from your nose, from your when you defecate, when you urinate, you can pass blood, right? And there might be confusion as well, right? You will be in a sort of a confused state, right? Then the other thing is the urine output. Then there will be reduced urine output, and sometimes there will be no urine output at all for 6 hours, right? So this set of symptoms, we call them warning symptoms, right? So if you have warning symptoms, that is an indication that you might be going to a severe state of the disease, right? So this is basically the clinical symptoms.
Doctor, dengue is normally called like the breakbone disease as well due to
Yes,
the muscle
exactly.
pains and the joint pains,
Exactly, exactly.
right? So, I mean, that's a nice, interesting point to note there. And also, doctor, what would you say the public, all of us, should exactly either do or avoid when we have these symptoms?
Right. So now, do and don'ts. Now, if you have fever, now it little bit different in the times of COVID-19 as well. I will explain it later, right? So now, if you have fever uh, for 2 to 7 days duration, right? So what you should do is, if you have fever in these times where there is similar diseases are spreading, for example, COVID, dengue, and other viral diseases, right? Within 24 hours, you have to see a qualified medical doctor, or you have to go to a hospital, right? Within 24 hours, right? It is important that you go quickly because early referral will save lives, right? Then the other thing is you only have to take paracetamol for fever in the correct dose, with the correct duration, right? Only paracetamol. Yes, only paracetamol, nothing else, right? That is the other thing. Then you have to have adequate rest. Then you have to have adequate amount of fluids, right? And the early referral is the most important thing. When you go to a doctor, he will advise how you can proceed. That is your sort of do. And your sort of don'ts are uh, some people used to take sodium or mefenamic acid or ibuprofen. Those kind of drugs people take from the pharmacy without the prescription of a doctor, right? So you don't need to take these drugs. In dengue, we advise not to take these drugs. And there are another group of drugs called steroids. Now, if you have bronchial asthma, if you are asthmatic, you used to take these drugs, right? Like prednisolone or dexamethasone. But in dengue, we also advise not to take these drugs at all. Why? Why? There is a tendency that internal bleeding can happen when we take these drugs, right? So if you are a chronic asthmatic or if you are taking drugs for asthma, you have to, if you have the fever as well, you have to consult your doctor as soon as possible. Then he will advise how you can take drugs, right? So those drugs are sort of prohibited, or we don't advise to take those drugs, right? The other thing is uh, don't take sort of home remedies. Most of the people rely on home remedies and they just stay at home. But when they present to a hospital, it is sort of too late, right? So if you have fever, for 24 hours, you have to have a medical consultation, right? That is a must in these times. Normally, we say it is within 48 hours, but with these times with COVID and all other diseases, we say like you have to consult. Yes, uh, um, consult a doctor, and you have to have adequate rest. As I said, don't do any strenuous exercises, sports especially. We have seen cases people who are diagnosed with dengue, they feel like they don't have fever anymore and they go on to have exercises and sports, and they come up with severe forms of dengue as well, right? So have adequate rest, adequate amount of fluids. Those are the kinds that you should be mindful when you have dengue.
You share with us your knowledge. So basically, most of our amazing viewers today are mainly parents, especially from Lyceum and outside Lyceum as well. What could you give, like what advice could you give our parents in regards to especially like clinical symptoms and early referral as well?
Right. Now, when you talk about the dengue patients, when we analyze at the National Dengue Control Unit, we almost in every day we analyze the number of patients we receive as well as what are the age cohorts of these categories, and we analyze the age cohorts of these categories. We can clearly see that ages between 5 to 90, right? That is sort of school going age. Uh, the around I mean that out of total of dengue cases, around 30%, nearly 30% of these dengue patients are from 5 to 19 years of age. That means the school going age, right? The mean age is also a little bit different. The mean age is 24 to 29, but around 30% is school going age, right? So there is a significant threat to school going children with dengue, right? Why? Because as you know, dengue mosquito bites between the daytime. Now, most of us think that the dengue mosquito will bite at night. It bites at night, but mostly it bites at the daytime. What is the time frame? Now, dengue mosquito bites between the in the mornings at around 7 o'clock to 11 o'clock in the morning, and in the evenings from suppose say like in at around 3 p.m. to 7 p.m. So this duration of time, most of the school children will be at their playgrounds and they outdoors. They will be exposed to the bites of the dengue mosquito. That is why we are observing the 30% of schools, I mean, within the age cohort of total patients, right? So when it comes to children, now there are subtle differences between several age groups as well within the children itself, but they too have fever, high grade fever, right? They mostly refuse to eat, right? That's the first sign. They mostly refuse to eat, right? And there will be severe pain, continuous crying as well due to the pain, as you said, the breakbone fever, right? Then the other thing is reduced urine output or urine output, no urine output, nothing at all, right? So these will be the initial signs, right? And if you talk about the severe forms of dengue, for example, dengue hemorrhagic fever and complicated dengue, dengue shock syndrome, then there will be confusion as well. Your child, yeah, his or her behavior will be different from her normal behavior, right? So if you observe a feverish child with a behavior that you are not expecting from your child, that's not like normal, then there's issue. Then you have to suspect whether this is dengue as well, right? So those are the clinical symptoms that we observe in children, and as I said, in adults, the warning symptoms, so-called danger signs, you have to observe. Danger signs in the sense you will have continuous vomiting, the child will complain of abdominal pain, right? Then there will be bleeding as well from the gums, from nose, while you urinate, while you defecate, right? For example, in a girl child, there can be bleeding from her vagina as well, something like the menstrual cycle, right? So these kind of warning signs will be present. So if you have the warning signs, you have to consult a doctor then and there as soon as possible.
Like within 24 hours.
Within 24 hours, all right? One other thing, Kanika, I want to emphasize. Now, most of the children present to hospitals, I'm a public health professional, but clinicians, what our colleagues in hospitals or in clinical setup says, when there's fever to a child, most of the mothers, they don't use a thermometer. Now, it is important that you measure your temperature, your child's temperature, with a simple thermometer, right? It's not that expensive. A simple thermometer is not that expensive, right? What they do is they just touch their forehead and say, my child is having fever, right? That is natural. But you have to have some measurement of fever. That is important, right? Then don't give any drugs other than paracetamol. That's the most important thing. To reduce fever, what they do is they give some of the painkillers or some drugs like Brufen to reduce fever for the symptomatic relief. But that is not good for your child, right? So what you have to do is, if the fever is not getting down to a lower level, what you have to do is you can easily do a tepid sponging, right? You can use some of the mildly or moderately warm water, and you can sponge your child, right? So you can deploy some, I mean, you can do some preventive actions like that, right? So it is important that you go early to a doctor, right? You measure the temperature, you feed your child if he is willing to feed, right? You can give some soft food as well as drinks, right? But those drinks must not contain red colored drinks. Why we say that? Because in dengue, as I said, there can be bleeding from the orifices. Then when you take red colored drinks or juices or fluids, it can mimic bleeding, right? So that could be confusing to parents as well as for the clinicians as well, right? So you have to avoid giving those kind of fluids. Then keep him at rest. That is the most important thing. We have seen parents forcing their children, even with fever, especially when it comes to grade 5 scholarship, A levels or O levels, they are forcing their child to go to tuition classes or go to schools while they are having fever, right? That is very dangerous when it comes to dengue, right? So you need to have adequate amount of rest, right? So those are the clinical features of the children, basically.
So, for all participants here today, I myself, and I'm sure everyone here is really grateful that Dr. Lahiru is present here with us right now. So, feel free to show your gratitude and appreciation by commenting on our meeting chat box or by even sending us a reaction. So, doctor, moving on to our next question. Basically, like in this, the severe moment, this time period that we are in with this COVID pandemic and everything, a lot of people are having doubts as to what the differentiation is in regards to dengue and COVID-19. So, could you share with us a bit of information on what is the exact difference? Like, is there a difference between the COVID-19 and the dengue?
Yeah, very good question, Anika. Now, both diseases are viral diseases, right? COVID-19 is a virus as well as dengue is a virus, right? When it comes to viral diseases, right? At the initial onset of the disease, the clinical features are almost same, right? So that's the issue with COVID-19 and dengue. Now in COVID-19, you say you have fever, you basically have the body aches, you have the throat pain, and you have symptoms that is sort of respiratory symptoms aligned with the respiratory system, right? You have shortness of breath, you might have a dry cough, right? So when it comes to COVID, you have that set of uh, symptoms. When it's come to dengue, they too have the same set of symptoms, right? They have fever, they have body aches, muscle pain, joint pain. Then they have, as I said, reduced urine output. But the only differentiation at the initial onset is in dengue, we have very little, evidence of very little respiratory involvement, right? Respiratory system involvement is less in dengue compared to COVID-19. And that, as I told you earlier, the retroorbital pain is sort of pathognomic that is unique to dengue itself. But this differentiation can be made only by a qualified professional, that is a qualified doctor. So as general public, as a parent or as a student, you should not think that you are having COVID-19, you are having dengue, right? You can't differentiate it at the initial onset, right? And there are other factors that you can suspect you are having either COVID-19 or dengue. For example, now if you are a first exposure or if you have any exposure history to a COVID-19 patient, you can suspect that you will be having COVID-19. When it comes to dengue, if you are living in a so-called dengue high-risk area where the dengue cases are prevalent, then you can suspect I might be having dengue, right? So those kind of differentiations are there, but it is important that you yourself, you must not decide that, right? There are qualified professionals to decide that. Then your doctor, your family doctor or your hospital doctor will advise what to do. There are investigations to differentiate, right? What to do and how to take your drugs. So go to hospital and your family doctor early when you have fever these days.
Coming to conclusions.
Before coming to conclusions. Yeah.
Thank you. And doctor, what would you say? So basically, like not like you don't find mosquitoes in every single place, right? So what are the main breeding places of these dengue mosquitoes?
Right. Now, the specialty with dengue mosquitoes, Anika, now they have a life cycle of 4 stages, right? Out of these 4 stages, 3 stages are in water, In water. Only the adult mosquito is in the outer environment, right? All other three stages, they have a connection with water. Now, why this is important? Now, when there is water, then there is a chance of dengue breeding as well. Even a water from a teaspoon is enough for the dengue breeding, right? So you can, when we take example of a house, our home, you can have dengue breeding inside your house as well as inside and outside as well. Now, what are the places inside your home that can breed dengue? For example, now most of us have refrigerators at home, right? So that tray in the refrigerator where we collect the discarded water, there can be dengue breeding in that refrigerator tray as well. Then some of the flower vases, right? Flower pots. We usually put flowers on a daily basis, but we don't change the water, right? So that is a good breeding ground for the dengue mosquito. Then the other place, when you have a leak in your sink in the kitchen, you just put a what you call a plate, right? Something to collect the water. Now, this collection even can have dengue breeding as well. Now, this peculiarity of this dengue mosquito is the dengue mosquito will put eggs on these water, right? Now, to activate these eggs, you need water, right? Suppose now you have a very dry season, right? The dengue mosquito put its eggs on these plates, and there is a dry period, right? But still, these eggs will survive, right? Once the water is available, they will reactivate. So that is the danger, right? So that is inside the home. And when it comes to outside home, you have your rain gutters, right? If you are not cleaning your rain gutters on a frequent basis, the water can lodge there, right? So these water lodging will increase the chances of dengue breeding. Then you have your bird baths at your garden for beautification, right? But you don't often clean these bird baths, right? That can uh, create a very feasible environment for dengue mosquitoes to breed. Then you put some water for your pets, for birds, right, outside your home. Those places, dengue can breed. And if you discard some of the utensils, if you discard the yogurt cup or your curd, the utensil you use for the curd, then collection of water in these stuff, then dengue can breed. So the difference between the COVID and dengue, Anika, now if you stay at home, you will be safe from COVID, basically. But for dengue, if you stay inside your house, even if you are not conscious about your environment, you can still catch dengue.
Unless you know
It's
you
not
prevent
safe
it.
anywhere, right? So that is the sort of if you take your home environment, right? Then there are other places that can breed dengue as well. For example, schools, right? Since we are addressing a school-based community, now in schools you have we have observed now National Dengue Control Unit is conducting several programs entire year to do some source reduction. That means to reduce the sources of dengue breeding inside homes and as well as in other premises as well. Now, in schools, especially in the kindergartens, now you have your playing area. Now, in the playing area, there can be water collection points, right? When it comes to toilets, now for teachers and staff, you have separate toilets, right? For children, you have separate toilets. Yes. Now, during the vacation time, what you do is you lock all the toilets, right? So that no one can go inside, right? But the water that is collected inside the commodes or the squatting pans will remain. Now, that is sufficient for the dengue mosquito to breed, right? And there are enough places like gutters, then some of the discarded items, right? Discarded chairs, tables. If you keep them exposed to rain, that will create dengue breeding as well. The other important site is construction sites, right? Right. So for the construction, you can't do a construction without water. That is the simple truth, right? You need water for construction, but there are enough avenues for dengue mosquito to breed there as well. Now, if you have lift wells with water lodging, then there is a chance to breed dengue. Then you have some discarded building materials outside your construction site, then that will allow dengue breeding as well, right? Then if you use some of these polythene stuff to cover your sand and your cement, then this can breed dengue as well, right? So if your school is having a construction site, the staff as well as the students should be mindful, right? Right? You should be conscious about your environment. Otherwise, there can be pockets of dengue or outbreaks of dengue coming out of these sites as well. Right.
So those are the main sites.
Main sites, yeah.
And doctor, we also have quite an interesting question here. What would you say is the vital distinguishing features between malaria and dengue?
Right. Very good question. Since now
Yeah.
we are sort of again thinking about malaria as well now, because if you have heard from the news last week, we have 4 imported cases of malaria from foreign countries. Now, what is the unique character of malaria is now we have sort of eliminated malaria from Sri Lanka, right? There are no indigenous cases of malaria within the country. But the vector, now malaria is also a disease spread by a mosquito, right? But the vector is present in the country. Now you introduce the malaria parasite from outside, there are enough avenues that again a malaria outbreak will happen in Sri Lanka, right? So that is the danger. Now, previously malaria, we used to say that they have sort of a cyclical fever, right? Every other day, something like that. Every 2 days after, right? Something like that. And they have a special feature like a drenching sweat, right? People used to sweat a lot with that fever. But lately, what anti-malaria campaigns say, I'm not a malaria expert, that is why I'm quoting them, right? So what they say is the symptoms have changed, right? So it's sort of now, it's sort of a general fever, right? So if you are a traveler to a country that is malaria endemic, what are the malaria endemic countries? Most of the African countries and most of the countries in Latin American region as well as Middle Eastern region, right? So if you are traveling to those countries, many of the people travel for Africa for gem trade, for leisure as well, right? So if you are traveling to that kind of a country where there is malaria is endemic, then you should be conscious, right? If you have a fever, you should go and check for malaria as well, right? You can ask from your doctor even, can it be malaria? Right? So for a period of 1 year, after you travel to a country of malaria endemicity, you will have to suspect when you get a fever that you can have. Even it's still possible, right? Why we are saying that? Because it is important that we stop these imported cases because we have eliminated the malaria within Sri Lanka, right? So that is the difference between dengue and malaria. But as I said earlier, since lately we are observing very similar clinical symptoms of dengue, it's very difficult to differentiate between the two. And the other reason is we have another new mosquito that is that is called Stephensi, right? So it is sort of breed in the places similar to dengue vector as well, right? So that is the danger. So we need to be conscious about malaria, especially if you are a frequent traveler to countries that is endemic to malaria.
I mean, like especially when you go to like countries to like Africa and stuff, the main things you do there is actually outdoor activities like safaris
Yes.
and stuff, which is
Yes.
known.
Yes.
So people, especially our Sri Lankans, need to be really careful.
Conscious about that.
Right.
Yeah.
Doctor, so the one of the main, I think, questions that we would like to get an answer from you is how can we exactly prevent dengue?
Right. So very good question, Anika. Now, when you discuss about other diseases, most of the diseases we have a definitive treatment, either a drug or a vaccine, right? But when it comes to dengue, you don't have such definitive treatment. Yes, there are vaccines in the development stage. I will discuss it later. But up to now, we don't have a definitive treatment. Now, when you go to a hospital, what they do is they analyze your clinical symptoms, they analyze your reports or investigation findings, and they see whether you are in a critical situation, right? Whether you are having simple dengue fever or you are going to a phase where you can have dengue hemorrhagic fever, that is the most dangerous one, right? So they will analyze, right? Then accordingly, they will um, uh, sort of instruct you to take fluids according to a plan, and they will measure your urine output. So there should be a balance between your input as well as your output, right? So that is how we manage dengue. And for fever and other symptomatic relief, we do have drugs. And if you have a secondary infection on top of dengue, we have other antibiotics and other drugs. But for the dengue itself, what you need to do is you have to balance your fluid and you have to monitor your vitals, right? So that is why we ask patients to come to a hospital or come to a medical practitioner early so that your vitals can be monitored. That is why when you admitted to a hospital with dengue, nurse comes to your bedside every hour and monitor your urine output. She gives you a cup to monitor your urine output. She gives you a cup where you can measure your fluid intake, right? So there is a rigorous monitoring, and they do ultrasound scans to monitor whether you are bleeding inside or you're internally bleeding or you have fluid overload or you are leaking inside, leaking your internal fluids, right? So that is how they monitor, right? So we don't have a specific treatment or a vaccine, right? So it is important that we prevent the disease. So that is the strategy. That is why I earlier told you as well, prevention is better than cure, especially in dengue, right? So what you can do is there are several ways that you can prevent dengue, right? For example, you have your environmental modification and environmental manipulation, right? Then you have your chemical controls, right? Then you have your legislation or law enforcement. Then you have your community mobilization or awareness. Then you have your personal protective gear as well. Now, I will first tell you about the personal protective gear because we are discussing this with a student community, right? So now, as I told you, now students are exposed to dengue when they are at their school or their tuition class or their playground. Now, application of a repellent is important to your exposed part of the bodies. For example, if you are going for sports, your arms will be exposed, your legs will be exposed. Now, it is important that you apply a registered repellent so that the mosquito can't bite you, right? If you are in a doubt, what are the registered repellents? You can visit National Dengue Control website, www.dengue.health.gov.lk, and the list is visible to you, right? Then it is important if you
we can provide them with that website.
yes, yes, yes. And if your child is going to kindergarten or he or she is a primary student, you can use, if you allowed, you can use long sleeve shirts or trousers, right? So that you can cover the exposed areas of the body.
Yeah, we actually have like even back when I was in school, we were allowed to actually like under our t-shirts or anything.
Yeah.
We are allowed to wear like long sleeved clothing under our uniform just to be on the safe side.
Yeah, that is very important, right? So if you are allowed, that is a very good preventive measure, right? And when it comes to environmental modification, now what you have to do is be conscious about your environment within your house as well as outside your house as well. You need to clean your environment at least once a week, right? So in the leisure time, we do several things, right? So if you can dedicate at least 1 hour, right, to look into the places where there is water lodging and clean your gutters, clean your bird bath so that the mosquito can't breed, right? Clean your environment of your house inside your house, right? You can cover your discarded items so that they are not exposed to rainwater anymore, right? So you can either reduce your waste, you can remove, or you can close the lids of the utensils, right? And those kinds of behaviors, you have to have some kind of those preventive behaviors. That is important. The other thing is, now if you are talking about construction sites or schools, when you are designing your buildings, you can definitely discuss with your civil engineer or your architect, how can I prevent water lodging inside these buildings? How these gutters can be made so that there is no water lodging? How can we scientifically, on a very regular basis, how can we segregate our waste, right? How can we dispose them? How can we reduce them? How can we recycle them, right? Because those places will allow dengue breeding, right? So that is the other point. Then you have your legislation. I think it's important that we don't go for legislation. We have to create good behaviors, right? Inculcate good behaviors on children, so that they will carry it to the next generation, right? The other thing is, you have chemical controls that will be employed by a technical person, especially a National Dengue Control Unit or your medical office of health doctor, right? You have what you call larvicides to kill the larval stage of the mosquito when it is impossible for you to remove water. For example, in construction sites, right? Then you have your fogging as well, but we are not encouraging fogging, right? But what you see in the media, they fog, right? Spray things, yes, yes, like smoke, right? We don't encourage it simply because it will kill only the adult mosquito, right? Now you kill your adult mosquito, but the breeding sites are still intact, right? So what you need to do is, you have to first remove the breeding sites. That is the first behavior, right? In outbreaks, and if there is an epidemic or outbreak in a cluster of cases, we will do fogging. That is okay, but it's purely depend on the technical knowledge as well as the expertise of the medical officer of health or your MOH, as well as the central unit, that is National Dengue Control Unit, right? So they will decide whether it is suitable for this area to be fogged, right? And the other thing is, you have what you called intersectoral collaboration. For example, now you have Lyceum International here. Now you have to have some good connection with your local medical office of health, so that if there is a dengue case, you can report him. They can they can advise you how to control your dengue outbreaks, right? Those are the methods in very simple language how you can prevent dengue. Your behavior is the key to prevention of dengue.
So basically, the small practices and little bit of effort can actually save lives, right?
Yes.
Right. So, doctor, actually, now I think we've actually come to the end of our main questions. So, as I mentioned before, we'll be having a live question answer session. So, feel free to actually ask us any question that you may like to ask Dr. Now. You can send it in the chat box, or you can raise your hand actually, and I'll call you out and you can tell me your question. So if there's anyone who needs to ask any questions, you all can raise your hand. So else, if you all don't have any questions, we can move on and conclude our webinar. So before we do, please grab this opportunity and ask any questions if you all do have any. I'll give you all a few minutes. I think that will be enough for the people who do have questions to raise their hand and do so. Right, Nikini, you have raised your hand if I'm not mistaken. So Nikini, we will be unmuting you. So when you're unmuted, please let me know your question. Nikini, you're unmuted. You can say your question. Shanika Paul, you have raised your hand as well. we'll be unmuting you. If you can please let us know your question. If you're, I don't think we can actually hear you. There's a bit of a problem. If you can, if it's not too much of a disturbance, would you all mind sending your questions into the chat box?
Can you hear me now? Okay, gladly.
Nikki, our first person who asked us the question. We have unmuted you from our end. So if you can, feel free to ask us your question if you're comfortable, or else you can just type your question in the chat box as well.
My name is Nikki.
Right. So I think our question, we have a question coming in. Is there a vaccine available for dengue? And I think doctor already answered this question. But doctor, if you don't mind, could you answer that question again?
Yeah. Currently, there are several vaccines on development stage. You have several sort of stages of clinical trials. Now we have a vaccine that has undergone clinical trials stage 3 as well. That is just before introduction, but there is a strict regulatory protocol as well as some of the scientific criteria that you have to follow before introducing a vaccine.
Right.
So there are several vaccines on the pipeline, but the issue with vaccine is the peculiarity of the disease. You have several, you have subtypes of the dengue virus. So if you made one vaccine for one type, it will only give the protection against that type as well. So it's technically difficult, but people have tried several vaccines, and even they have given vaccines as well in some of the countries. But still, a very effective vaccine for dengue is on the pipeline, and the regulators, vaccine regulators, both in Sri Lanka as well as in international stage, they are closely monitoring how we can effectively give a dengue vaccine. Right. So it's still in the clinical trial stage, and we are hoping that it will come soon. But it has to be safe as well as efficient.
So I hope that actually answers your question. And also, so we have another question coming in as well, doctor. Is there any natural remedy that we can use for dengue?
Natural remedies. Now, we don't advise you to use natural remedies simply because now you have to have, a clear cut idea about this one. Now, as I told you earlier, for the fever, dengue fever, you have to only use paracetamol until you consult a doctor, right? What the home remedies will do is, now you will stay at home taking home remedies. Now, if you have the severe types of dengue or severe forms of dengue, like dengue hemorrhagic fever or dengue shock syndrome, then that's a huge issue, right? So there are home remedies for tested for long, right? But what we advise is stick to your advices and consult a doctor, because uh, the ways and the interventions are available to treat dengue, right? We can treat dengue, right? We can identify the severe forms as well. So it is important that you stick to these guidelines. And there's a common public perception that papaya juice, right? Yeah, will increase the platelet counts, right? Yes, they have seen there will be an increase, but platelet count is not the only parameter we see in dengue, right? Even though your body makes platelets, when there is dengue fever, those platelets will be destroyed as well. We see several parameters for dengue. For example, your white cell count, your white blood cell count, your platelet count, as well as the density of your blood, or what you call packed cell volume, right? So all these features has to be investigated to say that you are out of danger, not only platelet count. So to increase your platelet count, just to increase your platelet count, don't take any home remedies. Consult a doctor, a qualified doctor, or go to a hospital if you have fever. That's the message.
So basically, we have another question coming in. Right. So to basically cover up our earlier answer, do not take any home remedies. I mean, yes, papaya juice is very tasty, but try your best and go immediately to a doctor, and do not try to be a doctor when it comes to especially our children and dengue. And also, doctor, we have another question. It was in regards to how the immune
Excuse-
system of the child after recovery
After recovery from dengue.
is restored. So basically, how is the immunity of the child restored after the child gets dengue and is cured?
Right.
How can we restore the immunity?
Right. So in dengue, you have what you called in basically in severe forms, you have the febrile phase, you have the critical phase, and you have the convalescent phase. No, now this convalescent phase is the sort of your recovering phase, right? You little by little you come to a recovery position. Now, what is important is to maintain his immunity, his or her immunity after any viral infection, not only dengue, any fever, any viral infection, you have to have adequate amount of fluids, right? You have to have adequate amount of rest as well, right? So if you have rest and if you have adequate amount of fluids, then you are on the safe side. Other thing is you have to constantly be conscious about any other clinical symptoms that you might be developing, right? For example, now in dengue fever, when you have dengue hemorrhagic fever, you have fever for some time, and you again feel that you don't have any fever anymore. But that is a clear indication that you are going towards the dengue hemorrhagic fever. You have a fever period and you have a sort of a free period, but inside you are going to a more severe form. So be mindful about your clinical symptoms. Be mindful about your symptoms. That is why we always tell patients and the community, if your doctor advise you to take a report, even though you are now feeling that you are okay and you are out of danger, just go and see your doctor and show him your report as well, even it is normal, because you can, the doctor will be able to tally your investigating findings as well as your clinical symptoms and come to a conclusion. So there are no specific immune boosters, but what you have to do is you have to have adequate rest and good amount of fluids to be healthy after dengue.
And not, get confused when there's a period of no fever, because it might be
Yes.
definitely a silent killer indeed. So do we have any other questions coming in? If we don't have any other questions coming in, we can conclude our webinar. Right, so I guess our session is up for now, and with doctor's permission, we can have a future session as well. And doctor, thank you so much for your valuable time. So in regards in behalf, basically, in behalf and on behalf, another word sometimes, on behalf of Lyceum and for our appreciation sake for your valuable time here, we have a small token of appreciation, and I hope you like it.
Yeah.
So, doctor,
Thank you very much.
so much.
Thank you.
So, thank you again, doctor,
Thank you.
for
Thank you for the
enlightening
opportunity.
us on this vast subject. And also, I would like to thank our amazing participants for being with us throughout this webinar. It is unfortunately not in our control to put a definite end to this silent killer, but we can do our part, especially with help from people like this, to prevent this silent killer. I hope everyone gained at least something valuable out of this knowledgeable seminar. I sure did, doctor. So have an amazing evening. Stay blessed and take care. Doctor, before everyone goes, doctor, would you have any words to share with us?
Yeah. Now, one final word. Now, your life is your responsibility. So your behavior decides your future. So if you have fever, consult a qualified medical professional early. That is the message.
So an amazing
you,
message to end with. So stay blessed and have an amazing evening.